Hello, and welcome back to another episode of the Dental Hygiene Basics podcast. My name is Dana. I'm your host, and we are back with part 2 with the amazing Rachael. If you have not already listened to last week's episode, go back, listen to that one first so that you know everything that we talked about last week, and you can catch up and be ready for part 2. All right, everyone, let's get into the episode. Okay, so you're working through school, you're struggling with just everything going through the process, but what would be the biggest piece of advice you would give to maybe just someone who wants to become a dental hygienist? Like they're starting out where you started out and maybe they're going through some of the same struggles you were going through.
Figure out your why. Like why you want to do it. Because again, like that's going to be the thing that is going to keep you going on the hard days. It's going to wake you up and get you to school every day. I would say, figure out your why, ask questions, do research on just the program itself, get a vision for yourself. Why are you doing hygiene? Okay, once you do it, like what is the vision for yourself? Do you want to do temping? Do you want to do full time? Do you want to do part time? Do you want to do part time and work a fitness business? Like what vision do you have for yourself? Because that can be a part of your why. Like when you have a vision for a better life for yourself, that's going to help you want to get up every day and do the hard things because you envision a better life for yourself, So
Yeah, I love that. I mean, I don't know if I've talked too much about vision and just picturing what life is going to be like on the other side. I know for me, I could picture myself working clinically and I had a big why, but I think it really started to click when I realized I could be in education. And then I could start to picture it. Oh, I could be a professor. I could do this. I could do research. Like I had all these thoughts and I could really see it then. And that propelled me. I mean, even when things got hard when I was working clinically, just tough job, but I was like, I know what the why is. Like, I'm going to keep pushing forward because I need 5 years of clinical experience so I can become an educator. It's like just pushing forward, toughing it out. And it can be really powerful. And that's why they say, shadowing people, watching those day in the life videos, right? Like, the more that you can see it, touch it, envision it, it's kind of like you implant the seed in your brain that you're already it, like you can feel it. So I think that's really good advice. I love that. Well, we've talked about the highs, lows, but do you have a dental hygiene school memory that's your favorite or something that you've really enjoyed about dental hygiene school?
I wouldn't say there's one specific memory, but it's really like the small moments of just like laughing with your classmates before class starts. There's a few trips that we had to go to, like we went to a board review together, we got a hotel, and just like, spending time outside of class was fun, like when we would get together, but really just like the small moments of just knowing that we're all going through the same thing and just like laughing together, making inside jokes. I think that was like my favorite part of it.
Yeah, I love that. I mean, that seems to be what people say over and over again. The friendships, the camaraderie, the good times are the times you're spending with the people that you're there with. So I love that. That's great. Well, I would love to just have you share where students can find you if they're interested or have questions. If you wouldn't mind just giving us a little bit of your information.
Course, yeah. Instagram, I'm always on the gram, and that's at Rachael Jane, RachaelJane. And then my fitness business is Meraki Muscle Fitness. That's my Instagram for that. So
Okay, awesome. Well, thank you so much, Rachael, for being here and for sharing your story. And yeah, hopefully you enjoy your career. Have you started a new job yet, or do you have a new job lined up?
yeah, I'm actually currently working part-time at an office. So it's been going good. I've been working for about a month now for hygiene. I was doing assisting for a while until I got my license. So I got my license, been doing hygiene for about a month now.
That's amazing. How's it going? Is it good so far?
I do. I like it. It's going good. It's definitely much different than school, I will say. Like there's so much to learn, I feel. It's just like a shock from school to the real world. I mean, it's a real world in school too. But
Yeah, no, I know what you mean.
it's like an hour appointment. I'm like, okay, how do I do everything in 1 hour? Like this is crazy. Time management is definitely like the thing I'm working on the most right now and figuring that out. But other than that, it's been great. The patients are so sweet and it's super cool to go out of school and just know what you're doing, rather because when I was an orthodontic assisting, I was trained on the job. So it was like, it was very different. Now I can go out and I'm like, I know what I'm doing. I'm confident. And if you're in hygiene school right now, there's light at the end of this tunnel. Working is so much better than school.
Yes, and the nice thing is you go home at the end of the day and your work is done, right? Like, you're not having to study anymore, you're not having to worry about anything. I mean, you might if you're like me, you think about your patients, like if they're, how they're doing and all that kind of stuff, especially as you get to know your patients more. But beyond that, it is nice, like, at the end of the day, you just shut off and, "Hey, I'll pick back up with new patients tomorrow and continue on." But, yeah, I mean, I think you hit the nail on the head. It's a different experience and you're still learning, but it is so eye-opening to think about where you came from to where you have gotten, right? And I think a lot of times when we graduate and we get out there, you start thinking, I don't know anything, which isn't true because you know way more than you, when you started the program years
Yes.
earlier. And you make kind of an interesting point, which I don't know if you follow some of the politics and things that have been going on in dental hygiene, but there's a lot of talk about trying to lower educational standards, train assistants on the job to do scaling and things like that. You mentioned you were trained on the job as an orthodontic assistant, which is a little different, obviously, than what they're proposing. I was trained on the job as an assistant. I had a 10-week training. It was on Saturdays. It was like an 8-hour day. So really, I did not have much like in the way of registered dental assistant training. But then I went and worked at a surgical office and they fully trained me top to bottom, taught me all the infection control. And I thought I knew a lot going in to dental hygiene school. When I got there, I realized I barely scratched the surface of what I knew, right?
Absolutely. I mean, you just don't know until you're in hygiene school. You think that hygiene just cleans teeth, and you think, how hard can it be? Learning clock positions of where to sit, I was like, this is so confusing. I didn't know there was certain clock positions you should be sitting in. I didn't know there was more than like 3 instruments. I was mind blown. Medical emergency, just all of anatomy, just all of the classes that it takes to have a solid foundation so you can actually take proper care of your patients. Like that foundation of knowledge, I mean, it doesn't just go out the window. I feel that if you're gonna scale teeth and do a hygienist job, like you need the knowledge. And it's just wild to me that people are just trying to make it a on the job training type of thing.
Yeah. And, my thought process behind it all is okay, some of these states are going to pass these things. Little things have already kind of been passing. And if they're considered registered dental hygienists, okay, maybe it's not to my educational standards, but they're still our brothers and sisters in hygiene, right? And I think we owe it to them to be mentors to those people because they're going to be struggling, right? Like, think about how you feel as a new grad coming out of 2 years and then compared to someone who maybe doesn't have, that same educational process that they go through. But at the same time, if it does get pushed forward, which just anyone who's listening, if you're like, wait, is there an easier pathway to become a hygienist? Should I take that path right now? There's really not that many easier pathways, but I would still consider going the educational route for the sheer amount that you're going to learn. But also, too, I think a lot of these people who get into these roles will go on to continue their education. I think they're going to realize, you know what I mean? Like, there's something that I'm missing. That's at least what I think is going to happen.
Hope so.
I hope so too. But I'm the eternal optimist. I always think like it's going to be okay. But I
Right.
know that those people will need a lot of support. But, if you're listening to this and you're thinking, what does that future look like? Are those standards going to be lowered? Something that you said, Rachel, you're like, just, connecting the dots, thinking about taking care of the patient as a whole. You mentioned we're taking classes like oral pathology, we're learning medical emergencies, we're learning pharmacology to assess all of their medications. And that's something that, is not going to get trained in an on the job scenario. And just for kind of perspective, like as a hygienist, I found cancer, so it's like oral cancer, like precancerous lesions, things that were really small and difficult to detect, but without the training that I had, I would have never noticed that it was different because do you remember in your like oral anatomy class when you're learning just like about the normal anatomy and you're like, oh, that's a Fordyce granule. Oh, that's this. Oh, that's that. And then you get in the clinic and you show your professor like, what's that? I think that's something unusual. And they're like, no, that's actually very common, but you haven't looked in enough mouths to know what's normal and what's not, right?
Tori, like, if you didn't go to dental hygiene school, you're not gonna know what tori is, but you're gonna see clinically and, like, then understand, "Okay, this is why I can't do the X-rays," like, as well as usual, but, yeah, it's just so many little things that are like, "Oh my gosh, I didn't know there was so much information behind this little thing," like, yeah, just like you said, there's so many, like, gaps that need to be filled before, like, doing a hygienist job, and, like, they say that it's gonna be super scaling, But I mean, even just like with a prophy, like you're gonna go under the gums a little bit, like 2 to 3 millimeters, to get bacteria out. And it's just again, like you want to make sure you're giving the patient the best possible cleaning.
Yes, exactly. And that's what I think, we're going off on a little side note here, but I think it's an important conversation to have because people who are interested in dental hygiene may start hearing about these alternatives. And I think this is the place to talk about it because that's what the podcast is all about. But, if you're in a state and you're like, oh, act like a hygienist, but you don't have to go to hygiene school, you might just ask yourself the question, what is being missed there? And if you don't go through hygiene school, you do miss those intricacies. But also, like you said, we are trained as dental hygienists to go below the gums and to clean a surface that is not visible, that we have to use complete feel, right? Like, which, if you've ever tried to do something just by complete feel, is very difficult, especially when you're working on a tooth that's super small and you're working in millimeters. But at the same time, it's some of these programs aren't allowing these people to do that. They're training to only clean above the gum. But as you said, a good cleaning should always be at least exploring below the gum line to make sure that there's nothing there. Even if there's nothing there, at least you go there and you assess to see if there is or isn't, right?
And it took me a long time to be able to feel calculus, detect calculus. And it's like, you wouldn't think that it would be that hard, but I mean, it really is so tactile. And like, you really have to get a feel for your instruments. And again, knowing your positions and how to adapt your instruments. There's so many things that go into it. And you just can't learn that like quick, like in a weekend, you
Yeah.
know?
No, you can't. And like you said, even just the amount of instruments, because I know as a hygienist, sometimes I've temped in an office. I'm like, what is this instrument? I've never seen this before. I know a ton of instruments, but occasionally you come across ones. Eventually you get to a point where if you know enough about different instruments, you can adapt anything pretty much. But if you didn't know that a Gracie instrument only had one cutting edge and you just pick up an instrument and you're cleaning with the wrong cutting edge the whole time, you're not getting anything done. So there is something to be said. I think my new phrase is going to be brains before scalers, right? Like we need a solid brain before we put scalers in the hand because that's what makes us different, right? From, yes, you can teach anyone a hand skill. I mean, you really can. I think that I could sit down and teach someone a hand skill, but would they understand all of the depressions in the tooth, how calculus is formed, all of that? That's all lost. And that's what makes the job the job. It's not just the hand scaling, like you said.
Like we are providers, and I don't want that to be like taken. Like, not that it's going to be taken and not that I feel like they're necessarily taking our job or anything. It's just like how the world is, it's progression but at the end of the day, I don't think people realize that we are true like providers and like we have so much knowledge and so many clinic hours that we've dedicated our time to this career and
No,
yeah.
I totally get it. And I kind of fall in that camp too, and I think dentists feel that way too when hygienists are like, we want more autonomy, we want more freedom, let us do more skills. And they're like, no, don't take stuff away from us. And then with hygienists, they're like, let assistants scale, let assistants do local anesthetic. I mean, in some states, assistants are trained to do local anesthetic. I'm like, I just got local anesthetic in Texas like 6 months ago.
I know. But working actually at my office, I work with a lot of FDAs. And I mean, I haven't done any local yet. They're doing root canals and fillings and stuff like that. They have to wait for the dentist to come over and do numbing. And I was like, you know what? You guys should do FDAs should be able to do local. Like I'm kind of for that because I mean, that restorative side at my office is so busy. I'm like, so I see where it can bleed in and it makes sense in some places. And for some people, they think that like this makes sense. But like as a hygienist, we know that like it doesn't really like make sense.
Yes. Yeah. And, I kind of think about big picture. Like I said, I'm always the eternal optimist, but I think more autonomy for hygienists. And if that grows and we're allowed to diagnose, treat, do other things like local in all states and maybe build on our restorative aspect too, because hygienists like in Washington are, doing minor fillings and things like that. And so I'm thinking, okay, well, how is it working in those states? Like in those states, they've been doing local since the 70s, so it makes sense that now they're training their assistants to do that because it's like it seems like a natural progression. I kind of think like as one group rises, the rest of the group should rise as well. And so I think there is a place for expanded function hygienists. I think there's a place for expanded function assistants. The only thing I ever complain about is not having the education, right? It's like you need some type of standardized education, you need competencies, you need tests. That's what I feel strongly about. I'm like, if you can go through and, make it through all those benchmarks, please feel free to come and do whatever it is, even if I don't feel threatened by that. And like I said, but I think the growth has to happen in all areas, and the problem with hygiene is the growth hasn't always risen. And so it sometimes feels like we're being pushed down, and people are taking our job. But realistically, I think it's up to us to be the ones to fight for that autonomy. And with all these changes, we have seen, I think, a massive boost in just people like hygienists really speaking out about it now and trying to make change. So I think we're at a pivotal point. If you're listening to this and you're thinking, well, wait, you just talked about all this. Should I even go into hygiene? I would say yes. I don't know. What do you think? I still think it's a great career and I would recommend it. And I think we're at the tipping point. I think we're going to see better things come out of what's happening now. But I don't know. What do you think?
I agree. And you know what? I mean, you might as well, if you're going to be scaling teeth anyways, you should go to school. And also, you're going to be getting paid more for your knowledge, you know?
Yes.
Not that anyone should go into hygiene just for the money, but these assistants that are going to be scaling, they're probably not going to be getting much of a pay raise. And it's like, you might as well go get the knowledge and see for yourself what hygienists actually do and get paid for it because you deserve it. Just because you're doing some of hygiene's job doesn't mean you're gonna be getting paid hygiene money.
Yes, excellent point. And like you said, get the knowledge because this is what I always tell people when they're like, should I go to dental hygiene school? I'm like, nobody can take that knowledge away from you that you've gained. And when you're applying to a job and it's you versus an assistant that can scale, like if you're applying for a higher level job, it's like, oh, they have a master's degree. It's like, okay, you see that higher level of education. Now there's going to be some dentists out there that are like, ooh, I can pay this person less and they can do this job. But you have to think about the quality too, what's going to happen, the sacrifices. And eventually we're going to need knowledgeable, highly trained dental hygienists, I think, to manage some of the perio aspects of these super intentional cleanings. So I think that there's a broad spectrum of things that are gonna happen and play out. But like I said, the knowledge will never be taken away from you. And that's just something that again, it can't be taken from you. I think that's the best way to say it.
I mean, knowledge is power, you
Yeah.
know?
Yes, absolutely. Well, thank you for letting us kind of dive into this interesting topic, but I know it's hot on everyone's minds right now, and new students who are interested in dental hygiene, they may be seeing this stuff out there on socials, and I don't want them to be scared. And I want them to know that people like you just graduated, you're entering the workforce, and you feel good about it. Like you're glad that you did what you did. Okay, Rachel. Well, thank you so much for being here today and sharing your story. And best of luck with your career. I just can't wait to see where it takes you.
Thank you so much for having me. I appreciate it.